Welcome out there in television land to the holiday segment of It's Your Health. I'm here with my bride. We're going to inform and hopefully entertain you over the next 30 minutes, the fastest half hour in television history. We're going to be right back after this brief commercial message. Your lack of words today? We'll be right back.
What he said.
We'll be right back. Welcome back to the first segment of It's Your Health. Summer's gone, I fear. And before we get into things,
You fear? It's been gone a long time.
I know, but I hate the cold weather. And
if winter's here, can spring be far behind?
that sounds inviting. And so does this. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health, especially what she says. Okay, let's move right along here.
Okay, we'll start off with some headlines. The first one is the body fat that may help you to shed pounds. Dropping extra pounds has long been a goal for people who want to improve their health and appearance, but there's a different type of fat called brown fat that may help us. Researchers recently found that cold temperatures may help us make more of this good fat.
Yeah, brown fat is interesting as opposed to white fat. We all have some brown fat. Usually it's up in the upper torso. And you can make more of it, which will help you lose weight, as crazy as that sounds. And you can make more of it by getting colder, turning the thermostat down in your house, going out for a brisk walk in the winter, for example. Exposure to cold will increase brown fat and you will lose weight.
And where can I find brown fat?
It's not like this isn't a grocery store, okay? This is in our body, sweetheart.
It's primarily, though, in the chest and shoulder area.
I think I said upper torso.
Oh, that's what that means?
Yes, okay.
Oh, okay. I got it. All right.
Earth to Kathleen.
Next
Come in,
headline. Is breakfast really your most important meal? Your mother might have told you breakfast is the most important meal of the day, but some recent reports might make you think mom's take on breakfast is about as credible as other wives' tales.
Well, it is interesting. People are trying to cut down calories, so they skip breakfast, and usually they have a fairly nice lunch and then a heavy supper and then snack at night. So they end up eating more calories. And the way to lose weight is to graze small, frequent meals, for example, and breakfast would be one of them. So we would listen to your mom and have breakfast at every meal.
Yeah, but how many people have big breakfasts? They don't have small breakfasts. You ever go to IHOP? They have gigantic breakfasts.
Well, we're not recommending gigantic anything.
Anything?
Small, frequent feeds.
I see. No, nothing gigantic.
Nothing gigantic.
Okay, I gotcha. All right, the next one is a very serious one, and it's just hit the headlines. Laundry pod poisoning. It takes seconds. You know the new pods that they've come out with that you throw one in your washing machine and it holds the detergent that you need? Well, swallowing detergents can lead to many health problems, including lung damage, pneumonia, seizures, vomiting, and lethargy. It only takes a second, and we might say, but we would never swallow it. No, but your toddler might. They're bright colored, they fit in his hand, they're squishy, and if he decides that he's going to bite into it, all of that will go right into his mouth. They're very, very dangerous.
Yes, certainly is. They look and feel like candy, so I would be very cautious about having those around toddlers. Anything else, dear?
Well, dear, we could talk a little bit about incontinence.
Big problem. We see it a lot as our baby boomers are booming.
Could you just first take a second and describe what incontinence means?
Right. Well, the bladder, of course, holds our urine, and as the bladder expands, sometimes when we cough or increase intra-abdominal pressure, urine will leak out. And in some women have overactive bladders in which the bladder will go into spasm and they'll just involuntarily have urine come out of them. But there are certain things you can do to minimize urinary incontinence. Get a load of this list. First thing is watch the water. That sounds obvious. Alcohol is another big issue that can cause bladders to go into spasm. Caffeine, a lot of people don't recognize this, but caffeine is a diuretic. And so
what does diuretic mean?
It would actually be like taking a water pill. So you're going to end up putting more urine into the bladder. So caffeine I would try to avoid. As the list goes on, spicy foods can affect the bladder spasms. And acidy foods like fruits and juices, orange and pineapple, can also aggravate it.
I have a question. We're always told to drink cranberry juice if we have a bladder infection, but cranberry juice is acidic, so...
Well, I don't advise cranberry juice. What it is it's the vitamin C that can inhibit bladder infections. Okay, so
Okay.
I'm not
And
sure.
a bladder infection is different than incontinence anyway.
Correct, but if you have infection, you can have more incontinence. So that kind of goes together.
Okay.
And last but not least, even carbonated sodas, for example, have acid in them, carbon dioxide.
But you already mentioned caffeine.
Caffeine, acid,
But you mean sodas that don't have caffeine?
carbonated.
Just have to be carbonated.
Even carbonated ones will lead to incontinence. So follow this list. You might be able to cut down on your urinary issues by cutting back on some of these things.
I'm learning so much.
Well, that's why you're here.
It certainly is. And we're also here to talk about eggs.
You know, eggs got such a bad rap, and I'd like you to look at this list of all the great things that eggs have. They have protein, they have choline, which is great for nerve fibers, zero carbs, no sugar. They have essential amino acids.
They have all 9 essential amino acids.
Exactly. They're cheap sources of protein, and we really need to rethink about eggs.
They're the least expensive breakfast that you can have. Did you know that?
I did not know
They're
that.
less expensive than anything else, and they're naturally gluten-free for people who are worried about that.
Not that you would worry about cooking in the kitchen, but let's,
I didn't even bring up cooking.
all right, well, I know, but you act as though you were in the kitchen with...
No, I act as though I know something about eggs.
Alrighty.
And on that note, we're going to take a break while I straighten him out, and we'll be right back.
After this brief commercial message, remember you're watching It's Your Health. We're your leader in healthcare information. Welcome back from that brief commercial message. Remember you're watching It's Your Health. And speaking of commercial messages, you may have noticed that Viagra commercials have come back and are coming on strong, if you will, promoting the use of Viagra for erectile dysfunction. And the Pfizer people who make Viagra dropped this off at my office, believe it or not.
Do you know what it looks like? It looks like one of those wooden woodworking things that little boys would hit the top with a, oh, that one doesn't work too well. They would hit the top with a hammer and make it go down into the hole.
Right. Well, this is called the erection hardness scorer. And what the pharmaceutical company wants us to do is to give this to our patients and find out which one represents their erection or lack thereof. And they are graded from 1, 2, 3, and 4. And they are supposed to help us in terms of grading quality of erection in men. Now, sometimes this is very impersonal. And so we like to sometimes assign, a name to something like this. So this, like wet noodle, I don't know why Sammy comes to mind, but nevertheless, we'll call him Sammy.
Okay, Sammy.
That's Sammy. And then, of
Sammy's
course,
having a hard time. Well, he's not having a hard time.
he would be someone who would benefit from a Viagra-like drug. And of course, there's other ones, Cialis and Levitra. And of course, this is one which
Needs nothing.
Needs nothing. He just so interesting thing that's starting to.
And you take that into the patient?
Yeah, and they are supposed to push on them and assign their quality of erections. So. All
Wow.
right. So you heard it first on It's Your Health.
You doctors sure have
All the toys.
involved mechanisms to do your job, I'll tell you.
All right, so that takes care of
That
that.
leads me to a question. Are you ready?
I'm sitting down.
Why aren't there sex drugs for women?
That is a good question.
I know, that's why I asked it.
Well, first of all, you girls are a little more complicated than guys.
We're a lot more complicated.
And they have tried. For example, we can't give estrogen to women because of cancer risks. We can't give testosterone to women because of side effect risks. I can tell you it's an area of active research, and that as soon as something is given to us, you'll be the first to know. Okay, so.
That's so kind of you.
Help is on the way.
Yeah, I think sometimes it's that a lot of these researchers are men, and so they're concerned about the needs of men, and women get thrown along the wayside. I think that's sometimes what happens.
Maybe, but why would we not want to enhance your experience?
Because you're only worried about enhancing your own experience.
All right, well, as I said, when something is available,
I'll be the first to know, I know. Okay, and on the lines that we're unfortunately on this segment, low testosterone affects health, mood, and sex. The question is testosterone replacement therapy right for you?
Yes and no. Part of erectile dysfunction, of course, could be that you have low testosterone, the low T syndrome. But keep in mind the low T syndrome will cause a variety of other symptoms as well. For example, look at that list. You can not only have a low sex drive, you might feel fatigued, decrease in your muscle mass, hair loss, difficulty concentrating, depression and irritability, and a low sense of well-being, almost as though you were depressed.
Those are all symptoms of low testosterone.
Correct. And they can be treated if you do have a blood test and show that you have low testosterone. And it is generally more effective, as you might expect, in the younger person. Now, where it gets controversial is when you get an older person who has diabetes, hypertension, has stroke and heart attack risks, and they may have low T, and you supplant those with testosterone, you may increase their risk of stroke and heart attack.
Oh, that wouldn't be good.
That wouldn't be good. So I think that's where the controversy comes. You have to pick the right patient for what you're treating.
And there's different ways of getting it. There's a skin patch, a gel, a mouth patch, and injections and implants. There's all different ways of it.
Yeah, most people are using the gels these days, and they're very effective. And generally without side effects. People can be very grateful, especially if they fit in to the low T syndrome, those symptoms we discussed before.
Well, one question that comes up is, how is testosterone treatment different from the athletes who get these performance-enhancing drugs?
Well, they're not low on testosterone. They probably have more than most. So, and plus those hormones are more androgenic, although they may have testosterone in them. They're looking for just bulking up and getting muscle mass, and that stuff is dangerous because it can affect your liver and kidneys and things like that. So
And it's a much higher dose too, isn't it?
Absolutely. And so they're not low on testosterone, so you're giving a drug to someone who doesn't need it.
Gotcha. We've experienced this next thing with all of our children.
What's that?
Bad company. How do you keep your kids from getting involved with bad company?
Well, it's on the rise, of course. I think our society is becoming a little bit unglued, and so kids will seek help from other people, but this is sort of your area of expertise, is it not?
Well, a little bit. In the book that I'm writing about middle schoolers, this comes up quite a bit. And one of the worst things we can do as parents, but we do without thinking, is find fault with their new friend, or refuse to allow them to see them, or come up with some other negative thing. That will only draw them closer to that person. What you want to do is, if they're young, you want to make a play date with other good kids that they can spend time with, or you want to encourage them to spend time with other people. You don't want to badmouth the person, because that will only encourage them.
That's a big problem. So I think you have to, without micromanaging, you need to be a part of their life and perhaps not be their friend, if you will. And again, it reflects where we are in society. When we were growing up, we went to church every week. We had supper every night. The family that sort of prayed together stayed together, and that's gone by the books.
We did the same thing with but it wasn't just your generation, our children's generation. We had supper together every night. We went to church every Sunday. We did it with our children. I'm sure there are plenty of people who are still doing it.
Well,
and on that note,
we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back.
He's got that down to a science. Welcome back to It's Your Health, and I am sitting here with not only a wonderful man, but a scholar. He has just completed the most rigorous training and work and was recertified in geriatric medicine. There are very few doctors in this area who are certified as geriatric physicians, and he just became recertified, and we're very proud of him.
Thank you, sweetheart. And of course, treating you has given me some expertise in that area as well.
Don't expect another compliment from me.
Okay.
As long as you live. And I'll take one quick minute and say hello to Lucille. Lucille shops at Kathleen's Collectibles, and she talks about how much she enjoys watching the show, and she especially enjoys when I pick on you. That's her favorite part. So hello, Lucille,
You should
and
be
thanks for watching.
You should be at home with us.
No, she shouldn't.
You'll get more of that.
Let's do the first headline.
Okay.
Sleep on it. A good night's sleep helps you think more clearly throughout the day, and it may keep you clear throughout your life.
There is no question we are sleep deprived, and we need to get through what we call restorative and restful sleep. And when you don't, bad things kind of happen. As illustrated by this, my one son dropped off his 2-year-old and was worried.
He's such a good babysitter.
Was worried that the old man couldn't take care of him. We went outside and we frolicked in the leaves.
They did.
And we came home and we got a call worried about who's watching who. So here it is.
Uh-huh. You were doing a lot of babysitting that day, I remember. I, of course, was doing nothing, but you were busy.
We were babysitting each other.
I'll tell you, that's a beautiful picture.
Thank you so much.
That's Daniel James.
So moving right along.
Oh, okay. New thoughts on fats again. Americans aren't becoming slimmer. We have cut down on fats, but we're not becoming slimmer. And that's because we have picked up on carbohydrates instead. And what we have to remember is that everything needs a balance. You don't have to cut out all of your fats. You don't have to cut out all of your carbs, but you need to have a balance if you want to get on the right weight or the weight that you think you should be.
Right, I call them the wicked whites. Anything that's white, we should stay away from. For example, breads, pasta, potatoes.
Rice?
Kind of. It could be a wicked white. But so the carbs are the killers, and you really need to eliminate those. And it's interesting because we were told to stay away from saturated fats, which is not the issue.
But it's part of the issue.
It's part of the issue, but if you go on an Atkins diet, which may not be the healthiest thing, you're going to lose weight. Why? Because there's no carbs, no wicked whites.
No kidding. You teach me so much that I never knew before. And now here's something I know nothing about, which never happens. I always know everything about everything.
She does.
Yes. hepatitis C, what is it, and why is it being advertised now as that there's help available?
Well, part of the problem is that we're getting an epidemic of hepatitis C, particularly in the baby boomers, believe it or not, and even the younger crowd, if you will. And there's good treatment for it. It's a sometimes silent disease, and you don't even know you have it. So I would get screened for hepatitis C, particularly, because it's out there. Well, you can get it through exposure to needles, for example, blood products, sometimes bad behaviors. So it's a silent disease at times. It should be screened for.
And how does it hurt you?
Well, it affects your liver. It can end up with cirrhosis. You can end up, believe it or not, with liver cancer as a result of it. So these things can be actually treated. So get a load of this number and the website to take it to the next level, if you will.
So that they don't have to feel that there's nowhere to turn. There really are lots of places to turn to.
Exactly, no doubt.
Go ahead.
Well, I wanted to just talk about bad behaviors. I just came from a course up in Boston at Harvard, and it was
working on his geriatric recertification.
And we had some issues there with addiction and addiction medications and along those lines. But here's the take-home point, which I found fascinating. They showed research after research that the adolescent brain, the teenage brain, is not an adult brain as much as they think they are. And exposure to things like marijuana, alcohol, drugs, irreversibly changes the brain chemistry, irreversibly changes the brain structure. And they've shown study after study that just marijuana use in a teenager will irreversibly lower his IQ and put him on a different road for life. And here with all this business of legalizing marijuana and having teenagers exposed to this, I mean, it truly is, and not to sound like an old fuddy-dud, but it truly is a very dangerous thing to expose the adolescent brain to drugs. Truly is.
Yes, it is. And again, I bring it up again because I'm working on writing that. The kids who are exposed to that are more, there's more chances that they'll be named as attention deficit disorder. There's a greater chance that they're going to get in trouble as adults. They're going to get arrested. Lots of bad things can happen, and you need to be very vigilant with your children.
Yeah, the teenage brain is not an adult brain, and that's part of the problem.
And very quickly, speaking of our teenage brains over here, we have our Virginia Jane, and we want to mention very quickly about heartworm. And heartworm is a disease that will kill your dog, and it does it thanks for your help, it does it in a very destructive way. It's a horrible way for a dog to die. And so we recommend strongly that you give the heartworm tabs. They only cost about $25. They're good for a year, and they'll keep your dog in good condition. Your dog can get heartworm from mosquitoes. They can't get it from each other. So even though there's not mosquitoes in the winter, keep giving them their heartworm medication.
She wants to comment, maybe?
Do you have a comment? Come here, Virginia. Do you think so? Did you have your heartworm medication? Okay. And I think on that note...
Geez, how come you don't do that to me when I come home and kneel in front of you?
Because you never kneel in front of me, that's why. Good dog.
Thank you for watching us. Hope to have another show similar to this, right? Where we...
Oh, not similar to this one. Oh, no, no. Much different than this one.
But again, thanks for watching, and we hope we've informed you and entertained you. Remember, You're watching Your Health. We're your leader in healthcare information. Right, sweetheart?
Yes, and have a wonderful holiday season.
Say goodnight, Gracie.
Good night, Gracie.